Here in the U.S., advanced practice providers like certified registered nurse anesthetists deliver care when and where they're needed. These advanced practice nurses are involved in every aspect of anesthesia in all types of settings, especially in rural areas. But for many years, they've received reduced reimbursement rates from insurance plans compared to other anesthesia providers for giving the same types of services. Angie Mund, president of the American Association of Nurse Anesthesiology, and Mr. Tracy Paul Young, regional director of AANA and the CEO of YPS Anesthesia, join us now to tell us more. Good morning to you both.
Good morning.
So how are inconsistent insurance rates compromising patients' access to care?
CRNAs administer 50 million anesthetics per year in the United States every year. So hospitals depend on revenue for CRNA services to be able to keep their doors open and to provide a wide range of services to their patient populations that they serve. For example, obstetrics anesthesia, pain management, pediatric anesthesia. And what we're seeing in the marketplace is insurance companies are cutting reimbursement to CRNAs based solely on our licensure and not on quality or outcomes or any other data. And what that does is it decreases reimbursement to hospitals for our services and puts them at financial jeopardy, and they could potentially either cut back on services or, even worse, potentially close their doors completely, as many rural hospitals right now in the United States are on the brink of financial ruin, essentially.
Well, since laws to end provider discrimination aren't being enforced, how does that impact CRNAs, medical professionals, facilities, and hospitals?
I think the biggest impact is the access to care piece that Tracy was just talking about. It also creates a disincentive for hospitals to hire an anesthesia provider that gets paid less reimbursement. It also, because of that, creates a more expensive anesthesia model that can already be a challenge to the places that Tracy was talking about. And we know in 2010, legislation was passed, like you noted, that legislators clearly decided that insurance companies should not be discriminated against a provider solely on nature of credential. And what we've been doing since Congress looked at it again in 2020 is we've been working with the departments, Treasury, Labor, Health and Human Services, to create rules. And what those rules would do is they would let insurance companies know, number one, is legislation says you need to reimburse at the same rate. And number two is it creates penalties so that if insurance companies do not follow the intent of the law, is they could be penalized for not doing that.
What needs to happen to make these laws enforceable?
Well, we really need these regulatory agencies to promulgate the rules that Angie was just mentioning to basically penalize insurance companies from actually cutting reimbursement for no other reason other than the licensure. So if you provide the same level of care, the same anesthesia with the same drugs, the reimbursement, in our opinion, should be the same. And based on the intent of the law, it would agree as well. So we really need the departments of Labor, Treasury, and HHS to promulgate these rules and get them into effect as soon as possible to help save access to care. And your viewers can go to a website we just created called accesstocare.aana.com to find out more information about the topics that we've talked about today. And we really appreciate the opportunity to mention what CRNAs are and the services that we provide. We're often called the best kept secret in healthcare because patients don't remember us after they receive anesthesia services. So being out there talking to you guys today has been very helpful, and we definitely appreciate the opportunity.
Angie and Tracy, thank you both for sharing this with us today.